A rise in sudden heart attacks in teenagers has doctors advising parents to get their kids checked.
WLKY's Addie Miners spoke with a doctor at Norton Children's about how to protect your teenager.
According to the CDC, about 2,000 people under the age of 25 die each year from sudden cardiac arrest. And most of those deaths could have been prevented with proper screenings, according to Dr. Heather Felton with Norton Children's Hospital.
So I think the first thing is that a lot of families don't realize that we recommend a well child checkup every year. And so it's a good time to do those screening questionnaires, those screening exams, where we look for underlying medical problems.
Underlying medical problems that, Dr. Felton says, are typically hereditary.
And there are a lot of different types of inherited heart conditions. So there are some that can weaken the valves of the heart. There are others that change the rhythm of the heart. And so it's just important to look to see specifically what runs in your family and what you might be at risk for.
COVID has also played a role in the rise of heart conditions in young people.
We've seen cases of myocarditis, of blood clots.
And it's not just showing up in teens who are active. Dr. Felton says it's important for all young people to get an annual screening.
Usually what we would do is when a patient would come in and ask specifically for a sports physical, we would ask those specific questions related to heart-related problems and do a really thorough heart exam. And now what's recommended is to do that for everybody, not just those patients who ask for a sports physical.
Addie Miners, WLKY News.
Dr. Felton says to ask your child's doctor for a heart screening at their next checkup so they do not need additional visits.